If you're a man between 40 and 65, you may have noticed that intimacy feels different than it once did. The energy is there, the affection too, but something about connection, satisfaction, and confidence might have changed. It's not just age, it's anatomy, hormones, and understanding. Many men don't realize that fulfilling their partner begins with understanding her body's responses, scientifically. I'm Dr. Vera Sterling, a urologist specializing in sexual health, and today, I'll guide you through the medical truth behind the most effective positions for female orgasm. Positions that bring both pleasure and deeper emotional connection, grounded in real science. The physiology of pleasure and the science of connection, sexual intimacy, is far more than the act itself. It's an orchestration of hormones, neural pathways, and emotional connection. As men age, particularly beyond 40, shifts in testosterone, vascular function, and nerve sensitivity can alter performance and responsiveness. But what's less discussed is how these same changes affect the way couples connect. The focus often narrows to performance, when true satisfaction lies in understanding the physiological process of arousal, especially the female orgasm, which depends heavily on clitoral stimulation, pelvic muscle engagement, and emotional relaxation. The female orgasm originates primarily from the clitoral complex, a structure far more extensive than the small external glands often noticed. Beneath the surface, the clitoris extends internally along the vaginal walls, forming two long crura that envelop the vaginal canal. During arousal, increased blood flow engorges these tissues, heightening sensitivity and creating an optimal environment for orgasmic release. When partners select sexual positions that align anatomical contact with these internal structures, the likelihood of climax increases significantly. Position 1. The modified missionary, with pelvic tilt. While many perceive missionary as ordinary, it remains one of the most effective when performed correctly. The key lies in pelvic alignment. By placing a soft pillow beneath the woman's hips, the angle of penetration shifts upward, stimulating the anterior vaginal wall, where the internal clitoral network and G-spot are most responsive. Scientific imaging studies have demonstrated that this position promotes greater contact between the penis and the anterior wall, leading to enhanced arousal. The intimacy of face-to-face contact also facilitates oxytocin release, the bonding hormone, which deepens emotional connection and trust. For men, this position allows controlled depth and rhythm, vital factors in prolonging performance and avoiding premature ejaculation. Gentle, deliberate thrusts enhance endurance, while sensory awareness maintains synchrony with a partner's cues. In clinical counseling, I often emphasize that pleasure should be mutual exploration, not competition. When both partners focus on response rather than result, satisfaction rises naturally. Position 2. The woman on top, cowgirl variation. From a physiological perspective, this position gives women control over depth, angle, and rhythm, empowering them to stimulate areas that produce maximum sensation. It allows the clitoral complex to align closely with the pubic bone of the partner, creating friction and targeted pressure. In a 2018 clinical study on female sexual satisfaction, women consistently reported this position as one of the most orgasmic due to the enhanced self-control and the ability to adjust movement in real time. For men, this posture reduces the need for constant thrusting and minimizes fatigue, allowing better maintenance of erection quality, particularly for those experiencing mild erectile dysfunction or vascular sensitivity. The key here is communication, encouraging a rhythm that suits both partners while maintaining eye contact and touch, reinforcing emotional intimacy. The act of sexual connection is not mechanical, it's profoundly neurological. Every caress, glance, and breath exchange activates the parasympathetic nervous system, lowering stress hormones and facilitating arousal. Too often, men approach intimacy as performance rather than partnership. Yet when men adopt positions that favor her anatomy, they also rediscover their own confidence and emotional fulfillment. Clinical insight: the role of blood flow and nerve sensitivity. Many men are unaware that both male and female orgasms rely heavily on vascular integrity. Adequate blood flow ensures optimal sensitivity, and factors such as hypertension, diabetes, and even prolonged stress can dampen this function. Regular pelvic floor exercises, cardiovascular activity, and avoidance of nicotine can dramatically enhance performance for both partners. In my consultations, I often remind patients that the most powerful sexual medicine is awareness, understanding your partner's body and responding with patience and curiosity. These are the foundations of lasting desire. As we continue, we'll explore 2 more scientifically proven positions that not only heighten female orgasmic response, but also rekindle passion, connection, and confidence, especially for couples navigating the changes that come with age. The path to deeper connection and lasting pleasure. The most rewarding intimacy is not spontaneous. It's intentional. As men mature, understanding that pleasure evolves with physiology is essential. Erections may become less rigid, stamina might shift, but sensitivity, communication, and emotional connection can become richer than ever. When both partners embrace this change, sexual experiences grow more meaningful and fulfilling. Continuing from where we left off, let us explore 2 more positions that science and clinical evidence support as especially effective for enhancing female orgasmic potential, while restoring confidence and mutual satisfaction. Position 3. The side-by-side spooning variation. This position, though gentle and relaxed, is one of the most underestimated tools for achieving deeper intimacy. When both partners lie on their sides, with the man positioned behind, penetration occurs at a shallow angle, naturally stimulating the posterior vaginal wall and allowing prolonged contact. The slow, rhythmic motion reduces performance pressure and enhances control. From a neurological standpoint, this posture promotes relaxation by engaging the parasympathetic nervous system, reducing anxiety, especially for men who may struggle with performance stress or early climax. The side-by-side position also offers extensive access to clitoral stimulation through touch, which can be coordinated with gentle thrusts. For women, the simultaneous stimulation of external and internal structures, combined with the emotional comfort of physical closeness, creates the ideal environment for orgasmic release. A 2021 review in the Journal of Sexual Medicine reported that couples who engaged in slower, sustained movements while maintaining full-body contact experienced increased oxytocin and dopamine levels, deepening both trust and pleasure. For men, this position encourages mindfulness. Because movement is slower, each sensation is more perceptible, allowing greater control over arousal levels. This mindful engagement retrains the body's response mechanisms, improving endurance naturally. Many of my patients describe this posture as rediscovering connection, a reminder that intimacy is not about speed, it's about synchrony. Position 4. The edge of the bed, with partner supine. Among the most scientifically stimulating positions for the female orgasm is when the woman lies near the edge of the bed, hips slightly elevated, while the partner stands or kneels at the bedside. The elevation allows a deeper angle of penetration, directly stimulating the anterior vaginal wall, the same area that houses the internal extensions of the clitoris and the G-spot. This alignment promotes consistent, rhythmic friction on the most responsive zone, enhancing the intensity of pleasure. From a clinical perspective, this position also supports optimal blood flow for both partners. The man's standing posture ensures full engagement of the pelvic and core muscles, which maintain rigidity and endurance. For women, the lifted hips encourage pelvic circulation, increasing sensitivity and lubrication. With slight adjustments, such as maintaining eye contact or holding the partner's hands, this position transforms from purely physical into profoundly emotional intimacy. Physiologically, orgasms in this position often result from the precise synchronization of muscular contractions within the pelvic floor and heightened clitoral stimulation. Many female patients report that this position produces not only stronger orgasms, but also a sense of emotional vulnerability and closeness, an effect amplified when the encounter is unhurried and emotionally attentive. The medical perspective. The science behind lasting desire. At the heart of sexual satisfaction lies the body's remarkable ability to adapt. As men age, endothelial function, the health of blood vessel linings, can decline, impacting erectile quality. However, research has shown that couples who engage in consistent, mindful sexual activity experience improved vascular and hormonal function. Intimacy releases nitric oxide, a molecule vital for blood vessel dilation, and this physiological response benefits not just sexual health, but overall cardiovascular wellness. The female orgasm, in turn, promotes pelvic muscle strength, mood elevation through serotonin release, and even improved bladder control. As a urologist, I see this connection daily. Sexual health is an essential pillar of total well-being. It is not indulgence. It is biology, balance, and bonding. For couples between 40 and 65, understanding that sex is not a race but a language can transform their relationship. The key lies in staying curious, patient, and emotionally open. When men approach intimacy not as proof of virility, but as an act of affection and understanding, performance anxiety fades and genuine satisfaction emerges. In every consultation, I remind my patients that sexual vitality is not lost with age. It simply changes shape. The best intimacy stems from empathy, communication, and anatomical understanding. The 4 positions discussed, modified missionary, woman on top, side by side, and edge of the bed, each engage different aspects of female pleasure, all rooted in physiology and science. Together, they serve as more than physical techniques. They are invitations to reconnect, to rediscover not just the body, but the bond. Pleasure, after all, is not just about what happens in the body. It's about what is shared between hearts. Dr. Vera Sterling, urologist and sexual health specialist.